this month I'm going to go ahead and talk about something that is really interesting and something new. So a lot of patients come to me nowadays and they are very inquisitive about this subject, so I wanted to talk to you about this. I'm going to talk about dental implant. Let me share a story of one of our patients. Her name is Windy. Windy is in her late 40s. She has a very beautiful smile, very vibrant smile. She has always taken great care of her teeth. She goes to dentist every 6 months. She takes really good care of her teeth. One fine day, she trips, falls, and traumatizes her front tooth. Smack in the middle, right here. Broke the front tooth right at the gum line. When she came to see me, she was devastated to know that there is no way I can save her teeth. That tooth has to be taken out. Traditionally, whenever a tooth has to be taken out, there's the option of a bridge. Bridge is a process where we grind down 2 adjacent teeth and then prepare a 3-teeth bridge. The 2 side teeth of the 3-teeth bridge anchors onto those 2 teeth that are ground down, and the third one, the one that's in the middle, is the one that is a replacement. Fidi did not like the idea of grinding 2 good teeth, and not to mention that this bridge has an average lifespan of about 8 to 10 years. Average lifespan, so every 8 to 10 years you would have to get it replaced. So is there any real way to bring patients like Windy back to wholeness, back to normal, where they are not self-conscious about their smile, they are not self-conscious about their speech? We are in 21st century. Is there any real way? Yes, the answer to that question is dental implants. Dental implant is a titanium metal post that we go ahead and surgically place into the patient's jaw that actually replaces the root of the tooth. Once the implant is placed, we go ahead and actually anchor a tooth right on top of the implant. Many patients like Windy, millions of patients every year lose a lot of teeth, either to trauma, decay, or gum disease. And dental implant is the new breakthrough technology that's an answer to that. So, let's talk about more about this implant. So, whenever patient loses a tooth, I tell patients you have 3 options. Option number 1 is implant. Option number 2 is bridge, and option number 3 is something that is a removable plate, something that can be placed in and taken out. We already know about bridge. Bridge has serious drawbacks. The other option of removable denture or plate has even worse drawbacks. What happens is when patient loses all their teeth, or when patient loses a single tooth, your gums start shrinking. And gum starts shrinking, the bone starts losing, the musculature on the face starts sagging, and you start noticing that the nose kind of goes down, the chin kind of protrudes out, so patients have something that is called witch-like appearance. It is really sad, but that is true. Now, not only that, but patients' speech get affected. The denture does not fit well. Patients are very self-conscious. A lot of patients can even go into chronic depression. Apart from the psychological effect, there are a lot of physical effect as well. Patients are not able to chew their food properly, so they start having digestive problems. They have to take a lot of medications to cure that digestive problems. It not only affects the quality of the life, but it also affects the lifespan. Implant is this new breakthrough technology that came in 1950s. In 1950, the first time titanium was identified as something that is biocompatible or that can be used inside the patient's mouth. Around 1956 or 1960s, somewhere around there, the first implant was placed. In 1982 is where in North America, implant was considered as one of the best treatment modalities available to replace a single tooth or full denture. And so it's been over 30 years since implant has been done traditionally in United States. But it seems to be that patients are more and more aware recently. The goal of modern day dentistry is to bring these patients back to normal form, function, so they can chew confidently, they can talk confidently. That's what Wendy did. Wendy got her, we did an implant for Wendy, and she got her vibrant smile back. If you have any questions about implant, or if implant is right for you, uh, please give us a call. For next month or so, we will be going and doing a no charge consultation. For any patient who has some questions about getting implant, please give us a call. Thank you so much. Nice talking to you.